Welcome, everyone. Welcome. Okay, welcome. Danielle, would you like me to just go right ahead and start?
That would be great.
Okay, well, we're off and running then. Hi, welcome, everyone. So delighted you're all here today. I am Dr. Lisa Faille, and I am pleased to be here today with my co-presenter, Lauren Bennet. I am a full-time faculty member in the Master's in Forensic Psychology online program, and Lauren Bennet is a graduate of our program. So it's really wonderful that she's able to join us here today. We also had some co-contributors, some current students in the Master's in Forensic Psychology program, Jelena, Skaro-Soots, Joy, Aytona, and Shirley Leo, who could not join us for the presentation here today. All right, without further ado, I will go ahead and get started. So today we are talking about the adverse impact of the COVID pandemic on adolescent mental health. The goals of our presentation today are to share with you the types of stressors that occur very often for adolescents, the types of mental health disorders and concerning behaviors among adolescents as a result of the pandemic, and then strategies for improving their mental health for these vulnerable adolescents. So adolescent mental health. Well, one of the first things that you look up, that you find when you start looking up information about adolescent mental health, is that they are not likely to seek help for mental health issues. As we all know, adolescence is a time when our youth are looking to branch out and to be less reliant on adults. So seeking help from a therapist, or even just recognizing that there's an issue that they need help with, is not their strong suit. The adolescent brain is still working on its problem-solving skills, and recognizing that therapists are a tool for assisting them in their mental health just isn't quite something that many adolescents are familiar with. And suicide is the second leading cause of death for ages 10 to 17. And that is so young, I think. It's the second leading cause of death, again, related to the adolescent brain. It's so hard for them to step outside of whatever just happened today, whether they were bullied or humiliated or feeling isolated, ostracized. It's so hard for them to realize that adolescence is finite and temporary, and there's so much more to life after that, and adulthood is this wonderful part of life that they will quite possibly enjoy much more, far greater than adolescence, and yet they don't really have the cognitive skill set to be kind of forward thinking in that manner yet. And that's why they are particularly vulnerable to suicide. So there's a little bit of good news here, that during COVID, the data actually indicate that suicide itself has not increased. The downside is that suicidal ideation and gestures have. Some of the adolescent mental health issues that have arisen might include anxiety, depression, other disorders that are maybe less obvious, like excoriation disorder. That is skin picking disorder, and that's a type of obsessive compulsive disorder. Also, adjustment disorder, as they adjust to pandemic life, which has been an adjustment for all of us. So let's look at some of the psychosocial stressors that our adolescents experience. Our youth are going through peer isolation, frustration, boredom, probably getting less exercise. Even if they don't do a lot of exercise in school, they might even just walk to school or walk to the bus stop. At least they're getting out every day. Financial strain, sleep pattern changes, just general uncertainty, the uncertainty that we've all been through during the pandemic. Uncertainty is much harder for younger people because they're, again, with their brain development, they're still kind of thinking a little more in concrete terms. Particularly, I want to draw your attention to the peer isolation. The peer isolation is huge because, as I mentioned a few moments ago, at this time, adolescents are really trying to break away from reliance on adults, and they tend to focus a lot more on their peer group as a means of connection, socialization. And when that is gone, you're taking away a huge part of their daily life. And to not be able to have in-person interactions, that's huge. So I think it's really important to not underestimate that. And I just want to mention, I'm sorry to interrupt, Danielle. I see 2 people are in the waiting room. You might already have seen that.
Yep, I'm working on it.
Oh, I figured. And then I also want to mention the financial strain aspect of it. So often we think of finances as affecting the adults in the family, which they absolutely do. But when it comes to teenagers, any teenager who had a part-time job, it was probably the exact type of job that was eliminated during the pandemic, such as being in food service, right? Working as a food server. Other things like, think about what you did as a teenager, babysitting, things that light office work. Offices were closed, restaurants were closed, and households were instructed not to allow non-household members into the household. And plus, the families that they were babysitting for didn't have anywhere to go because all the restaurants and movie theaters were closed. So they also lost income and jobs during the pandemic, but also too, even if an adolescent was not working, they are still keenly aware of the financial strain of their parents. They're aware of that. They pick up on that. They can see if mom or dad is out of work, not able to earn income, and feeling the stress of that. They're old enough to be aware of what it means when parents are not working and don't have income. And that can be just hugely stressful for a teenager. That adds to the uncertainty, and it just kind of becomes a cycle. Now I would like to turn it over to my co-presenter, Lauren.
So while there are a lot of psychosocial stressors, there are prevention methods that can actually reduce suicide for youth. One of these is the U.S. Garrett Lee Smith prevention program. And Garrett Lee Smith was actually the son of a U.S. senator who committed suicide the day before his 22nd birthday. So his father actually enacted this program to try and prevent that tragedy from happening to other families. And it's administered by the Substance Abuse and Mental Health Services Administration. It is a universal community-based program, so that involves gatekeeper training, outreach and awareness, screening and early detection, clinical services, continuity of care, and means restriction. So these gatekeepers are actually helping to educate these communities, and the approach itself is tailored to each community. So they include all of these methods, and overall that helps because it's actually unique to the community that needs it. It is cost effective, and when compared to those who do not use this program, there's actually a reduction of youth suicide. Next slide. This one is a little different because it actually indirectly addresses suicidal symptoms. And this is the Health Behavior in School-Aged Children Symptom Checklist. And instead of directly asking about their suicidal thoughts, it asked about identifying common health complaints. And that's actually split into 8. And you can see that it's headache, abdominal pain, backache, and I can't see the rest of it. Irritability or bad mood, feeling nervous, sleeping difficulties. And they actually put these into 2 subdimensions. So you have the somatic and you also have psychological complaints. And they actually have determined that that's a overall assessment of psychological well-being. So there are actually correlations between the complaints with suicidal ideations and behaviors. So you can kind of see that by indirectly asking those, you actually get a good idea of how that relates to suicidal symptoms. And the one that was the most significant was feeling low. So that one compared to the other 7 actually was a better indicator of suicidal symptoms and how that linked to suicidal ideations and behaviors. And the one that was least significant was actually backache, but they were all significant when compared to suicidal ideations and behaviors. There's also the Beck Depression Inventory, and that one's pretty common, and that just is self-administered, and it helps assess any depressive symptoms. And there's also the Beck Anxiety Inventory for Youth, and that's actually designed for ages 7 through 18. And that's scored the same way, but it would just be anxiety symptoms compared to depressive symptoms. And thankfully, during a pandemic, they can both be administered online. So that's very helpful, and that's more easily accessible to do that.
Great, thank you. Thank you, Lauren. So in addition to suicide screening measures, we also know that there are other factors that work in suicide prevention. Most importantly, outreach to parents and guardians, caretakers, to say, hey, these are the services that we have. Maybe that outreach might also include, here are some warning signs of what to look for. Making sure that there's that dialogue with parents and caretakers, because what every school system wants is to have parents who can say, I have a question. I know exactly whom to reach out to at my child's school for information or to give information with any concerns about my child. Also, what is really helpful is peer-to-peer mentoring. Going back to that theme of adolescents being hesitant to seek out or rely on adults. Well, an adolescent might not be comfortable saying to an adult, I'm really struggling here. But if there's a peer mentoring program, they might feel comfortable saying that to another student, to say, is really crummy right now, or in whatever language they would use to share that with a peer. And then you would have other adults involved in the program as a backup. So it wouldn't be obviously exclusively done by peers, but there would be that initial reach out, and knowing that teenagers might just feel more comfortable talking to another teen, that could really go a long way towards identifying any teens who are at risk for any suicidal gestures or behaviors. And then also expanding the use of telehealth. In the pandemic, that's kind of been, no pun intended, a lifeline for people, because that is a way of having connectedness. So having school counselors who are accessible and available through a telehealth platform, that can be really, really helpful. And then to have really inclusive responses, it's so important to make sure that whatever interventions are done, that they are culturally sensitive. There's an added stigma of obtaining and receiving mental health treatment among people of color. So we really want to make sure that any responses for addressing adolescent suicide risk, that they are culturally informed, and that includes the screening measures, that includes the any types of reach out that that is done. Even the use of telehealth, it's ideal to have diversity among the therapists who are available for telehealth if a school system is utilizing therapists. So that's very important, because suicide intervention is never a one-size-fits-all approach. So it's important to be as inclusive as possible when reaching out to our youth. And these are our references. And we would now like to open it up to any questions that anyone has about our presentation here today. I'm going to, let's see. Oh, I'm looking in the chat. Okay. Oh, great, thank you. Yes, as Danielle mentioned, feel free to put your questions in the chat if you like, or I certainly invite anyone to go off mute to chime in with questions. Or maybe we just really explained it all so well that, or maybe we left you with so much to think about. Oh, going back to the slide about screening measures, sure. Did you want, was this the slide that you were thinking of, Erica? Okay, all right, so Erica, yes. And Brandy, I see your comment as well. We can certainly revisit that slide as well. So Erica, did you have a question about this, or you wanted to see it to just look at some of the information on it?
Yes, I just wanted to double check the back inventories. So I got that. Thank you.
Okay, great. All right. And Sandy, I see that your hand is up. I'm going to go to the slide that Brandy requested about having inclusive responses. Brandy, is this the slide you were thinking of? And did you have any questions?
Yes, I do. This is the slide I was thinking of. I was just curious what, if you could expand on what those inclusive responses might look like, that would be great.
Sure. Inclusive responses, well, most importantly, they need to recognize that there really could be greater hesitancy on accessing mental health services for people of color. So that kind of, I guess the way I can phrase it is, the best offense is a good defense. So a really great way to be inclusive is to make sure that the people who are accessible to our diverse youth have diversity in and of themselves. If every therapist that a school system utilizes is all one gender or all one race, then that might limit the comfort level that more diverse youth has with that particular demographic. So inclusive responses, I think, really start with having greater diversity in the field to begin with. That's, of course, easier said than done, but that's really important to always think about for hiring practices, retention practices among any mental health providers who work with adolescents. And I think the other part that I refer to is making sure that there's an awareness there. There is a history there in medicine, but in other fields as well, where systemic racism has woven its way in. And that systemic racism can be a factor in hesitancy for accessing services from a particular group for people of color. So that might mean making sure that whatever the demographics are of the providers, they should have a very strong knowledge of cultural competency and inclusion, which means understanding the particular stigma that people of color experience regarding mental health, and being informed as they approach members of this group. I actually think you've really asked a great question, Brandy, and that might be a whole presentation in and of itself. So maybe I'll think about that for next year. All right, and then I see we have a question from Sharon, but I want to get back to Sandy. Sandy, what is your question?
My question was, do you have any tips for clients that are feeling out of control during the pandemic specifically, like for my seniors that missed out on their prom or missed out on their graduation, or parents who lost jobs and they were planning to do other things and they're feeling overwhelmed? And what tips do you have?
Right, because it's more, Sandy, thank you for bringing that up. It's more than just peer isolation, right? It's the loss of all of those high school experiences that are the milestones of adolescence in many ways, whether it's prom or graduation. Missing out on a graduation is a big deal. I know some parents who are just as sad about their children missing out on a graduation as they are. And even other activities. Many sports activities were canceled. Chorus activities were canceled. Plays were canceled. So all of the types of experiences that our youth like to engage in as part of the fun part of school, right? Because school is not just all book learning. School is also about learning teamwork on the soccer field and turn taking on the stage. And there's so much more to it. So to have them lose out on all of that, I mean, I probably could have added some of what you said, Sandy, to this list of some of the psychosocial stressors of our youth, because they're just this general sense of loss and missing out. So first, I think when you approach members of this group, it's absolutely essential to acknowledge how hard it is, acknowledge and validate about what they're talking about, find out what their particular loss is, and then acknowledge and validate, listen. And that's a primary approach in therapy that a big part of our work as mental health providers is not so much to make these bad or difficult or awful feelings go away, because we don't have the capability to do that. Instead, our role is more to listen, understand, and really hear their pain, their sorrow, their loss, and to help carry that weight. Because the weight of those feelings can be just so much, so overwhelming. Overwhelm was a good word that you used, Sandy. It's overwhelming for them to bear it on their own. As a therapist, we're helping them to lift some of that weight. We're carrying some of that burden with them as we let them just talk about their feelings, share their sadness and their loss. So just being there as a support to saying, hey, I care that you've lost so much. And that's where I think some support groups can really come in handy. It is possible to do support groups over Zoom meetings, but I think that also can address some of the peer isolation that the adolescents have experienced, and also reminding them you are not alone. So many of your friends are struggling just as much as you are, and that's I guess that's the nature of the pandemic, is that isolation. And it is so easy for teenagers to forget that this is happening to everyone. Everybody else is struggling, even if it doesn't seem like they are. Everyone else is having a hard time. This pandemic has not been easy for anyone. So those are some thoughts I had, Sandy, about ways to support our youth as they go through this just incredibly difficult time. So thank you for that, Sandy. And then I see, Sharon, that you have a question. What is the appropriate response for teens with suicidal ideation during COVID? Is a hospital stay feasible? Is it an appropriate option at this time? Oh, Sharon, you have asked some great questions. Honestly, it's a very case-by-case basis situation. Certainly, it would not be logical to have a teen enter a psychiatric facility if it puts them at risk for COVID, particularly if they have underlying health conditions. So in most cases, I think it might make sense to not risk the transmission of COVID, especially if they go into a mental health facility, a psychiatric hospital for a couple of days and then released, which really often happens. And then if they were exposed to COVID and then come home and expose older family members in particular, that would probably not help their mental health. So the goal is, of course, to mitigate risk of exposure at the utmost. And then also, I would reach out to the family, make sure that the family members know. Would it be possible to do family therapy? Is there a way to teach the family members how to play games, simple games, card games, spoons? I doubt it, whatever, just fun things that they can do together as a family, because it can be so easy for families to forget that, okay, we're here together all the time, but we're not necessarily doing fun things together. So together time is not the same as fun activity time. So encouraging them to set aside time to be together, doing something fun as a family, something interactive, ideally that does not involve a screen. So I would think that as much as possible, you want to try to connect with the family to make them aware, and if necessary, to make the family aware of concerns you have, to the point of making sure that the adolescent does not have access to anything related to something of harm or any potential plans. Certainly there are a number of ways to harm oneself, and the internet is a double-edged sword where people can look up easy ways to engage in self-harm, sadly. So that might mean parents need to monitor history of where their teens are going online. It might mean that maybe teens can only access their computer in public areas of the house while these concerns occur. Now, teens are probably not going to like either of those, but when it comes to safety, it's okay to do things that teens don't like if it keeps them safe. So, but again, if a teen's suicidal ideation is so massive that all these prevention efforts do not seem as though they will be efficacious, then yes, hospitalization would probably be the last resort. So it certainly does depend, Sharon, but you've asked a really great question because, you know, there's so much that you want to protect during COVID. You want to protect their mental health, you want to protect their physical health, and it's the most challenging when those two entities seem to be competing interests. Other thoughts or questions? Oh, you're welcome, Sharon. Thank you. Okay, I don't see anything in the chat. I don't see any hands up. All right, well then, Lauren, did you have anything to add in answer to any of the questions?
I see we just got a new question from Erica. It says, thoughts on therapists providing telehealth when students are back in buildings?
Okay, did you have thoughts on that, or would you like me to field that?
I actually work at a subacute facility and we use telehealth. So I think it's been very helpful. I feel like maybe even after some of the restrictions of COVID are lifted, that maybe we could keep using that because it might be more like a norm now. So I feel like that would still be a good way to communicate, but what are your thoughts?
Thank you, Lauren. I actually agree. As we all adjust to the new normal, Erica, who knows what that is going to look like. But certainly, if a student is seeing someone for telehealth, an adolescent, and then they, you know, were allowed to go, you know, resume in-person activities in schools, I wouldn't want them to miss out on that connection. So maintaining it, because there might be a readjustment to returning back to in-school life, because there are challenges with that as well. It's going back to being around people when you haven't been around people for a year can be a big change. So whatever way possible to continue any support that an adolescent has been receiving during the pandemic, I think that would be really, really productive and beneficial for any youth to have that continue. And if that means continuing on telehealth, then that's great. If it means continuing in person, I think that works as well. So as long as they get to still meet with their therapist, that's a good thing. And I think as Lauren suggested, telehealth is going to be here to stay. We know also that telehealth benefits many populations, and that includes teenagers who don't want to be seen going into the guidance counselor's office at school, but it benefits people in rural areas. I'm talking about adults now. It benefits people with mobility issues, and it benefits people who have all types of disorders that make it difficult for them to leave the home. Depression could be one, agoraphobia could be another. So I am curious as well, Erica, to see the expanded role that telehealth will have in our future. All right, so with that, I really want to thank everyone for coming today. I really appreciate your attendance and all of your questions. I particularly thank my fabulous co-presenter. Oh, we have one more thought. Okay. All right, we have a vote from Monica that you are ready. Okay, thank you. You're going to be doing some office work and at-home work in high school, and some in-person groups. A lot of telehealth still in your future. Well, thank you, Monica, for serving this really important population. You do great work, and all of you who work with our youth, I thank you for that work. And with that, I'll bring our presentation to a close. Thank you, everyone. Thank you all for coming.